If you've recently been told that you have some arthritis, the question is, what now? What do I do? Am I stuck to a life of pain? Am I going to be in a wheelchair? Am I never going to be able to get out of the chair again? Absolutely not. The first thing is you need to start looking at why have you got to where you are. At the end of the day, we're all responsible for our own bodies. And okay, sometimes there's a trauma that may increase the rate of arthritis occurring, but most of the time it's actually because you've not looked after yourselves as good as you're meant to. So one of the most important things at this point is, how can I stop it getting any worse? And so arthritis, itis being inflammation and arth being joint, just means inflammation of the joints. And it's only the inflammation that causes the pain. Because most of the time on x-rays and MRI scans, we can find huge amounts of arthritis with no pain at all. And so getting really good hydration, good anti-inflammatory based diets with lots of healthy fats and lots of different coloured vegetables is absolutely perfect. We want to increase as much movement as possible. Arthritis is not a reason to stop moving. You want to try to move within pain-free. If there's too much pain, it's generally because there's too much inflammation. And so that's something that you might have to investigate with us to find out, why is there inflammation in the first place? Is there some type of immune reaction? Sometimes there can be unresolved infections in other areas of the body that are driving a systemic inflammatory response. Or sometimes that joint in question is the good guy and it's trying to do a good job to help out an area that can't do as much. Perhaps you have an old injury in another joint that needs strengthening up so that we can give the arthritic joint some rest. And so really you need to have a bit of an investigation, and you need to look at your own sleep patterns, your hydration patterns and your nutrition habits to first get the inflammation down. Then any physical factors could be something that we could look at in the clinic to try and help you make a plan moving forwards to prevent it from getting any worse.